that we made for, we had for launching the Center for Design, you can have a sense of what is the mission and what is the, the ambition of the center itself. There is a video of the event that we made. And actually Sarah is the first, beside the 8 colleagues that I co-opted in a way into the center, so they were already part of the Northeastern community. I had a chance to hire Sarah as a research scientist, and after a month she was there, she was able to produce one. That's not the only idea that she came out with, but it was really one of the most, I would say, successful so far. And I see that really as an opportunity to think really about what design is today and what design can do, especially in situations that are challenging like the one we are experiencing in this time. So yeah, the mission of the center in general is to give space to some reflections on what is the role of design in general, and so how we can shape and continue to shape the discipline and the practice of design according to what we are experiencing. Because we know that design is very fluid and it's constantly changing. And one of the initiatives I'm planning to do is to create an observatory that uses web data to track the evolution of design and maybe to spot some interdisciplinary relationships that are just not clear, that are emerging, and so to be a little bit ahead in building the opportunity to connect with other fields. But that's another story, so I don't want to talk too much about
That'll be next week's Espresso.
Yeah, could be. Yeah, so that's the context where the Design for Emergency initiative started, but now I leave the floor to the virtual stage to Sarah for the introduction to that project.
Yeah, thanks, Paolo. And yeah, as you said, I joined the Center for Design just a couple of months ago, and I spent some years at MIT and previously at Politecnico di Milano as well. Funny enough, Paolo and I never met there and we never collaborated, but we are collaborating now in Boston. So it's a funny story. But anyway, I'm going to share my screen so we can start the presentation.
Please. Excellent, we can see it.
Perfect. So where did the project start from? Basically from two events that were quite shocking, I would say, for us, even if we were living in Boston. But the first one was on March 8th, when in Italy, Lombardy and 14 other provinces were locked down, trying to contain the coronavirus spread. And just a few days later, on March 11th, the lockdown was extended to the entire country. So people were required to stay home for an indefinite time, even if they said that it was probably going to last for 3 weeks. As we all know, it is still in place. So these two happenings were quite intense to live, especially from afar, probably because we have people and friends there and families. So this sparked a number of ideas, and I started to be concerned with this public health emergency, potentially becoming and turning into a social emergency, because asking people to stay home, to completely disrupt their lives and change their habits and not being able to see other people. I mean, that was a major disruption. One that had no precedence in history, probably, for the way it was being it was evolving. So this was a start, this question: can we do something to avoid that this health emergency turns into a social emergency? And I talked to Paolo about this idea of trying to do something, to use design to address these problems and these potential new problems that could emerge. And this is how Design for Emergency started. So the first idea was to create an open design platform in order to share possible solutions to face the coronavirus emergency by design. And these solutions could probably address new ways to connect people, or new ways to help people plan their time in a different way, or the possibility to prevent the spread of the virus by creating solutions that could help people engage in new behaviors, solutions to support people in different ways, like psychologically, mentally, but also in a concrete, very concrete way, and ways to entertain people. So this was the initial idea of the platform. But we immediately realized that, especially because we were living afar from where the emergency had started in Europe, so in Italy, we needed to collect information about how people were feeling and what the main problems of people were in that situation. So we created a layout, like a program, a plan made of 4 different steps for the creation of this platform and this project. And the first one was exactly a survey. So try to ask people how they felt and trying to understand their problems and their emotions, like in a better way. And then the second step would be the analysis of this data and the visualization of this information in order to help designers understand these problems and emotions and use this knowledge as a base to create ad hoc solutions for this situation. And then the third stage would be, of course, designing solutions. So allowing people to access this information and to ideate solutions and to share them through a platform that we wanted to create online. So giving the ability to share ideas in a very open way using a CC license, the most open one. And we were a bit concerned at the beginning because we knew that it's a bit challenging for designers to just share their ideas and because of course this is what they live on. But we also thought that, especially in that situation, this model could really be successful in order to create and to foster a rapid collaboration between people. So we knew it was risky, but we tried it anyway, and we believe it's working. And the fourth step was and would be the implementation of these ideas. So of course, we are happy to collect different seed ideas, a number of seed ideas, but our goal was really to create an environment where people could collaborate and could build on each other's ideas in order to implement solutions in a very fast way. So the first step, as I said, was the survey. And just, I think, 2 days after we first discussed this idea, we launched the Design for Emergency platform at designforemergency.com. So it was March 15th, and we shared the first survey in Italy. And we asked people to respond using just, I think, social media and our personal contacts. But incredibly enough, we collected 1,600 responses in just 4 days, which is a very good number of people participating in our project. So we were really glad to have such a good response. And so we started to analyze just after a few days the initial responses that we had collected, and we wanted to extrapolate insights that could inform the design phase. So the preliminary insights we got were, for instance, initially on trying to understand the emotions of people, and we created some visualizations that we published on our website. What you can see on the top right is like how people were feeling. So the most recurrent emotion among people was anticipation, surprisingly followed by hope, which was like a good sign. And then, of course, we had also more negative emotions. But also what we tried to do was to try to understand and cluster these emotions by age. So how different age ranges were reacting to this emergency and how they were feeling. And in this case, it's nice to see, it's interesting to see that there are some differences among age ranges in the way they were reacting and they were feeling in this context, in this situation. So for instance, very young generations were feeling much more sad than older generations. And at the same time, the older ones were being more hopeful than, for instance, people among their 30s or and their 40s. So there is a lot of information that could be extrapolated from this analysis, but our first step was just to put it out and publish them, which is what we did. I would say about the end of March. And of course, like the use was meant to be for designers, but we had also journalists who saw our platform. And for instance, this is an example of a newspaper article that was published in Italy that was talking about and representing our data, especially focusing on Milan and Lombardy, that was the region that was most hit by the virus.
Sarah, if I could just ask a question for a second.
Sure.
The audience on the call here is actually very, very deep in the healthcare sector. In fact, Nazanin, thank you for joining. She's an active physician at Einstein in Philadelphia, and she just came off the floor to join us, so thank you. But I think, like, if you can go back 2 slides, please, just very quickly. There we go, perfect. You know, Clark and I believe very deeply, and it's actually a foundation of these espressos, is the idea of, you know, design is a mindset rather than a process or an outcome. And so we work very deeply to get to that human-centered piece. And I guess I just wanted to pause here and give a chance for reflection, because I really think anticipation being so high followed by hope, I guess that would have been surprising. And then if I cluster fear, despair, and sadness, you know, that's another cluster. And I see those 3 clusters. I don't know if we would just want to open the floor for maybe 5 minutes, if anyone wants to reflect on just that. That seemed to have really struck me.
And I think it gains visually, even just looking at the bar charts and clustering by warm color and cool colors. I think the differences in age ranges is quite striking, and yet not surprising in that younger people would have more anticipation and more sadness and even anger than older people, who are probably escaping the economic ravages of this, even as the health implications are more severe for older people. I thought this was a stunning display of people's emotions. Terrific.
Yeah, absolutely. Thanks, Clark.
It made me wonder if just the age, when I saw it, if the older people, because they have more life experience, they have more bandwidth or capacity to include what's actually occurring.
Yeah, that was also my interpretation, actually. So one of the possible explanations could be that this is probably the first major crisis that people in their 30s are living, while people in their 60s or 70s have seen a lot more crises and problematic situations, even global. So that could be like tied to, this result could be tied to a different perspective on what's happening, definitely.
Absolutely. And in our design sprint that we're running, Dr. Jean, I'll get you in a sec, but just in this design sprint that we're running, we're designing for 3 personas, and one of the personas is elderly, and one persona is that kind of you know, late 20s, early 30s at quarantined in their apartment. And that was exactly one of the insights that group lifted up, was this idea that it was probably their first crisis for folks at that age. Dr. Jean.
Jeff, just a quick comment. It might be interesting to follow this over time. When we followed hope, optimism, resilience, and self-efficacy after the Hurricane Katrina disaster, what we found is, as the time went on, people became more positive in looking for the positive characteristics of gratitude and connection and meaning and hope. So it might be interesting to follow this over a period of time to see if the perceptions people have from the pandemic actually change.
Yeah, we actually, let me see if I can share this, because on the website you can find more visualizations that I haven't reported in the presentation, but we try to do that here, and we represented how the emotions are changing on a daily basis. One problem we had with this visual, I'm not sure if you can read it. enough?
Yes, it's very clear.
Enough. Okay. So one problem with this is that we couldn't really control the dissemination of the survey and the number of responses that we got every day. So we had a huge number of responses in the first 4 or 5 days, and then it really went down a lot. So we have normalized the results in this visualization, but actually the number of responses of the last, like the second half of this visualization is not nearly as high as the first ones that we collected. So we try to visualize it anyway, but we're not sure if it's completely reliable, unfortunately, because we don't have an even number of responses. But still, we had enough responses to see that there was a change. And I believe that some of these changes were due also to specific events that were occurring on some days. For instance, on the 18th, there was a restriction of the measures even further. So after that, we can see that, for instance, I think it's sadness is going higher after that date. So there was an interesting pattern to follow in this. And we are doing the same, and we're going to do the same also with the responses that we are collecting from other countries. So I'm going to talk about that later. But yeah, definitely
Well,
this is very interesting.
Thank you for pointing us to that. Yeah, please carry on. I just wanted to take a moment and touch on that human-centered element. But
well, and if nothing else, Jeff, if I could just jump in, that's a beautiful visualization. It's a piece of art unto itself. So I know there's data in it, but it's a beautiful image as well. Thank you for that.
Thank you.
Sure. Thank you. Actually, I mean, we did not do this alone, and I really want to point out that we had a great team of volunteers that helped us from the beginning. So, for instance, that visualization is from Sara Perazzi, where you can see her name here. So we had people volunteering both from the design field and from the data analysis field, computer science. So it's really being amazing to see how many people were available and willing to help us in this project. So that was the first kind of analysis that we performed. But then we also had a number of open-ended questions that needed to be analyzed. For instance, what is causing fear, or what is making you feel good in these days? So imagine we collected at that time 1,600, but now it's almost 2,000 responses to each question. So we had a lot of text to analyze, and we decided to use natural language processing, machine learning techniques in order to go through these answers and identify keywords and topics around each question. So this is what we did, and this is the second group of visualizations that we created. As you can see here, for each question, for instance, in this case, what makes you feel good? We have different topics that are big bubbles, and within these big bubbles, we have single key concepts. For instance, friends, or my children, or my husband. So this is another group of visualizations you can see from the website. If you go down here, oops, and you can interact with these, and for each question, you will see all the answer and the different topics. So yeah, it was quite an intense process. We went through different tools. We had, again, a really great team of partners who helped us in this, but it took some time. But in the end, we came out with these visualizations, and we think this is quite, it can be very useful, especially for designers, because it's not only important to know how people are feeling, but also why people are feeling that way. So what is causing fear, or what is causing anxiety, or what they're most afraid of, what convinced them to stay home. So what are people's motivations? All these, we believe, are very interesting and relevant elements to explore. So the third step, after doing all this analysis and publishing the results, which by the way are available on an open license, so anyone can reuse them, republish them, as long as they cite the initiative and the authors. So the third step in this process was to start designing ideas based on the knowledge that we had collected. So our idea was to share just what we call the seed ideas, so very high level concepts, not well defined, because one of the goals was to put people, like try to help people collaborate on each idea, or allow anyone to take inspiration and then develop their own solutions. So we are working on this phase right now, and we are working in parallel on 2 different activities. One is an open design challenge, and one is a set of design workshops that we are carrying on with partners. So again, if you go on the website, we opened the design challenge, I think 2 weeks ago, and there are some guidelines on how to participate. There are 6 different macro topics that can be addressed, but of course, these are just like initial possibilities. Anyone can contribute with any kind of idea. Just following the template, they can submit their ideas, and we are going to publish all the ideas that we receive. And again, these are open source ideas, so they are published with the FCC open license, and this is the idea, the basis of this. But I also wanted to point out the way we clustered the results of our survey in order to help designers build on top of this knowledge. So we have 5 areas. One is the problems and needs of people. And if you link on these, you can access all the visualizations that we had created. The second one is the emotions of people. So how do people feel, but also what is the cause of these emotions? The desires of people. So what are people missing the most? What would they like to do that they cannot do right now? The motivation. So what motivates them to stay home and to follow the rules? And then their free time. So what they're doing in their free time, and how much free time they have right now, because this also changed a lot compared to, of course, what was happening before this situation. So about this, we have collected actually already about 10 ideas, seed ideas. And if you click on each of them, you can find a more in-depth explanation. We are going to publish more ideas today, between today and tomorrow. That is the results of a design activity that we performed yesterday with Domus Academy, which is a design academy in Milan. So we have involved students, and we're going to publish the results of this 1-week activity, design activity. We are seeing people already getting in touch and connecting to each other to build on top of these ideas. So this is also one great results that that we have achieved so far, and we are very happy because this is exactly the goal of the platform. So going back to the presentation, I just wanted to point out other 2 elements. The first one is that after launching this initiative in Italy, we have been contacted by people all over the world wanting to contribute and to partner in this initiative. So since March, we have extended it to 5 other countries. Of course, the US, where we are, but also Brazil, Spain, France, and South Korea. So we have translated the website and the survey in different languages because we wanted to be able to involve people like anyone. So it was important to use the local language. And we're collecting responses. I would say that the response is a bit different from country to country, but for instance, in Brazil, we already exceeded 1,000 responses. And I've seen Denise Dantas, who is connected on this call, and she's our partner for Brazil. She's doing an amazing job in helping us developing this initiative also.
Welcome and thank you.
So the last step that I wanted to mention is the implementation of these ideas. We are collecting seed ideas. So we are going to do more design activities, not only in Italy, of course, but all over the world. So anyone can, or we're trying to partner with other institutions in order to create design activities based on the results from Italy, but also the ones that we are going to publish soon from other countries. But then the real goal of this whole initiative was to try to develop rapidly some ideas that could be transformed in solutions that could really be useful and helpful for users. So the implementation phase is critical, and we would like to enable collaborations between designers, developers, companies in order to create even rough prototypes of initial ideas, but something that can be really used by people and can make potentially a difference, and this is what we are hoping. So this is a very open stage, and I would say that at the same time that this initiative is very flexible, so it's evolving as the situation evolves. It's difficult to plan ahead because everything can change. So this first phase of the emergency is almost over in some countries, for instance, in South Korea. So we are trying to understand how, and we believe that the knowledge we have collected can definitely be used also in the second and third stage of this emergency, which is not going to be an emergency, but it's going to be what some are already calling a new normality. So how can we use and leverage the information we have collected so far, and we're going to collect also like in the future in order to create something that can really address the people's needs and people's emotions. So that's it. Thank you very much for inviting us and for joining us in this event. Thanks. If you have any questions, we'll be happy to discuss it.
Well, thank you, Sarah and Paolo. Thank you both very much for sharing. And obviously, this is an incredible endeavor. And thank you again for taking the time with all the interest that you have. I think that it's, again, this catalyzing where to jump off from is so key. And you've done just an incredible work of laying the foundation for others, as Clark and I like to say, to yes and. So in that spirit of yes and, I just wanted to open up the floor to any reactions or comments, or is there something that you saw that sparked your interest? If you have an idea and you want to share with Sarah and Paolo to get their feedback, the floor is yours. So I'll start calling on people soon, but I'll let those that's so inspired share their piece.
Jeff, may I?
Please, Christian, welcome.
Yeah, thank you. My video's not
Christian's
working.
a student at Haas. He's of Clark and myself. So please, Christian.
Thank you. So many thanks for the presentation, Sarah. Super interesting what you did. I did like a pilot some time ago using machine learning and topic analysis with to try to understand and find some insights. And I found like the person-to-person interview to be really insightful as well. So I was wondering, how do you see this balance between the face-to-face interviews and the first-hand insights compared to a pure data approach to really get into the bottom line of it? Because we all know that the beauty is on the details, you know, not necessarily on the repetition of the information.
Yeah, absolutely. So I think that this is something that we had discussed, and this is something that could be implemented, or could be implemented and could complement the approach that we have used so far. Unfortunately, the team was incredibly small. It was Paolo and I when we started, so we didn't really have the any resource to do any different additional activities. But I totally agree that a more qualitative kind of study would be really useful, and a more like individual based, and that deep study could bring so much more into this. But at the same time, I wanted to point out that we are in the following visualizations that we will publish, you will have the possibility to deep dive into the individual responses of users, of course, completely anonymized. The survey is anonymous in itself, but there won't be any identifier. But for instance, in the visualization that I showed you, the bubbles with the keywords, if you click on a keyword, you will be able to see all the responses that include that keyword, so the whole string of text. So in that case, and we believe that this is extremely useful for designers, because as you said, it's not only the broad idea or the broad keyword that gives some information, but it's also being able to explore it more in depth. So this is something we couldn't do for the Italian survey because we had some limitations in terms of informed consent, but we have changed that for the next surveys and the other countries. So we are going to be able to do that for the other responses we collected.
And I think what you didn't hear Christian say was he was probably offering to help.
Awesome. Great.
That's my sense of humor.
That would be amazing.
I love to volunteer people. Clark and I have a big, our underlying thesis is this concept of moving from being inspired by what we see to being inspired to take action. And you know, I saw that when I first saw your work, and which led me to invite you here, because we tend to focus on people who have that that inspire to take action, and to hear that transcendence that's occurred between those two phases, that's made them think that what's available to us as humans is probably more than we know, but it's certainly within our grasp, especially when it's towards the betterment of our fellows time here on Earth. So,
if I may add something. Okay.
Sorry.
Just to come to give Christian another opportunity to collaborate. I think what he said is a very interesting research area. I mean, that's something I was thinking a lot, and I'm still thinking a lot, how to complement quantitative methods with qualitative methods, because that's something that it's, you know, I've been working with data and visualization for a long time. That is my major research focus, and I'm pretty much more into big data now than qualitative data. But I see there is really a possibility to develop something in between this macro levels, and so to like a meso level of understanding people, you know, between social physics and something good.
Sorry about that. Go ahead.
Let's say between social physics and people trying to understand people on a global scale with big data and interviews that we are much more familiar with as designers. I think there is an intermediate level that is still to be, you know, discovered, and that could be really, really interesting. So how do we put those different ways of looking at people behaviors and feelings and emotions together? That's very interesting. Totally. For design research. So that's another possibility for a long-term collaboration for people interested in this.
Thank you.
Just a quick follow-up, Jeff, to close the point. Like, well, thanks very much for the answers. I'm happy to see how we can help. Like, in my experience, what happened with data visualization and this sort of topic analysis methodologies is that it's easier to confirm things than to discover things. So when you look backwards and you look at the data, you see, oh, here's where I can confirm that I have something. But for me, it was challenging to find like a way forward to a product through pure data visualization. It was just an insight that I got from a previous.
I like that. Thank you. It's easier to confirm than discover.
Yeah. Yeah, this is one of the biases that we know, confirmation bias. It's very strong. Yeah.
Nazani.
Yes, thank you. That was a really interesting presentation and a great framework. I'm very much entrenched in kind of the healthcare response, and I'm curious to see if you think this model has applications to the healthcare workers in particular, you know, as kind of a study group and a group that really can use the support of interventions to decrease trauma over time.
Yeah, I mean, I think a similar approach could be used there. Even if I would say that probably a more qualitative approach in that case might be even more relevant. So trying to talk to people to really get more in-depth insight, because the context is already well defined and is quite narrow. So in that case, probably talking to people and figuring out what the main problems are would be much more beneficial to fit the design phase than a broad survey like the one that we have done. But at the same time, like the idea of an open design platform could definitely be very beneficial for that context too. So the reason why we focus on a different, let's say, context or different kind of user was because many of the efforts were already focusing on the healthcare system, of course, because that was the most important thing to do at the moment. But at the same time, there was a lot of huge part of the population that was still having some consequences. So we wanted to address that. But I see your point, and I think that it would be really beneficial to use a similar approach also in that kind of context.
You know, one of the things that strikes me about the project and the data gathering and visualization is the difference between data as foundation of insight for design briefs, if you will, versus data gathering and visualization for maybe isolating the phenomenon or proving a point or testing a hypothesis. This is being used as the foundation for, I'll just call it design briefs. And I think I'd like to, if you have thoughts on this, Sarah or Paolo, what those distinctions are in terms of how you're orienting the research you're doing. Because I feel like it's quite different. And of course, I like that from my design orientation, but I thought it would be interesting to learn from you about your position there.
Yeah, I mean, maybe Paolo wants to, since he's been working in data visualization for a long time, maybe he wants to share some insights on this.
Yeah, I mean, I definitely see a potential in merging this different ways of looking, observing. I mean, these are just different lenses, different way of observing what's happening. I see, of course, limits in both, and that's, I think, as I said, it's a very interesting area of. I have one of my former students that graduated with me. She created after working several years in design agencies, mainly with Frog Design. She created an agency that is mainly is a service design agency that's mainly focuses on this on the research phase, and they are starting to use a combination of methods. So still doing interviews, like very qualitative research, but trying to complement that with the kind of observation I was referring to. Now there are many different tools nowadays, what is called digital methods that you can use. It's like an extension of digital ethnography that you can use to have knowledge about users and the behavior of people, the social behavior of people. So I think that's definitely an area that doesn't have yet solid methods and tools, but it's really something that I would love to explore, and something that is I think it's just a beginning. And because for now people tend to focus on the two extremes, so just distant reading on one side and close reading. So there is no intermediate levels, or there is no bridge actually between the two, and that's something that is, I think, will be definitely beneficial, because we know what are the limits of doing 5, 6, 10, 12 interviews, or whatever we can do, and we know what are the limits of looking at this visualizations of, I don't know, thousands of notes and links. Of course, both have their limits, but if we can develop something, a bridge between them, I think we will learn much more as designers. And that's just something again, it's, if anyone is from design and is interested in developing that as a research direction, I would be very interested as the Center for Design to work on that.
So just I don't want to monopolize here, but I will look forward to speaking with you both next week and putting the resources of our work at UC Berkeley, which is heavily based in qualitative research, put those together, and let's have a conversation.
Mm-hmm. Yeah, absolutely.
Thank you.
Yeah, going back to your point, I think we have not focused only on design-driven data visualization so far in our project. So some of these visualizations are quite broad and open, because we also wanted to give a portrait of what's going on, like regardless our design objective. But at the same time, the attempt to use these so another thing is that actually the bubble visualization, so the blue ones with the topics and keywords, I think that one is more oriented towards design. And also we try to our attempt was to cluster these visualizations in a way that could be more useful for designers. So the page that I showed you where there were these 5 themes where we collected the different visualizations. That was our attempt to help designers create a brief on top of this knowledge, helping them already to have a cluster of these data views. So I think we merged the 2 approaches. They are different. In this case, we had these 2 objectives at the same time. Of course, it was more focused on design, but still more general visualizations. We thought it could be beneficial to share.
Yeah, I really appreciate that effort, because it's, we always say that in design, the biggest, well, in life, but we particularly practice it in design, is this concept that framing the question is more important than necessarily the answer, because there never is one answer. And when researchers take the time to explore the human-centered element and lift up that qualitative data and then cluster it, those clusters can be informative for the majority of us who are doers, and to just give us that enough direction that we don't go off the road, but enough freedom to really explore what comes before us. There were a number of, I think it was DFA, Design for America, if I'm not mistaken, came up with a very similar approach right after the crisis emerged, was they did a clustering and came up with a few personas or a few areas to pursue. But you know, I took notes here. I really appreciate yours of entertainment, connection, support, planning and prevention. And yeah, one of the cohorts, or I should say the personas that we're exploring in our Saturday design sprint is around frontline healthcare workers, and how they're, and we've gotten it all the way down to the point where they're faced with, doctors by their nature are raised in a scientific environment with definitive information. And this crisis has presented unclear and uncertain information, but yet the patients are still demanding action, in the sense that they're coming in with displaying symptoms and of a possibly deadly disease. And that whole concept of moving forward with incomplete information has created some dissonance. And there's some doctors that are embracing that, but there are other, you know, healthcare workers who are challenged by that. And we, again, probed deeper beyond that to understand, well, it's really this issue of, you know, doctors have always had the answer, right? I've never met with a doctor who, you know, out of curiosity, says, gosh, that's a really great question, I don't know. And so how do they work within this context of ambiguity, which for designers is completely comforting. And it's this idea of vulnerability. And, you know, Dr. Jeff, who's on the call, texted me yesterday after our call with just such a beautiful reframe of, you know, how might we make vulnerability a superpower? And that very simple reframe was just so brilliant. And how do we move that forward to gain, I don't want to say interest is the wrong word, right? But to find the other believers behind that. And I guess that's maybe a time to throw it back to you. Is I looked at some of the seed ideas that you have, and it's brilliant. Yeah, for example, the one that just schedule your time at the grocery store, like obviously brilliant. But how would you design for something where it's more emotional? Like, you know, if we create a design brief that vulnerability is a superpower, take that prompt and run with it, if you wouldn't mind, for a minute or two.
Yeah, I mean, there would be a lot to say here. But I think, for
Please,
instance,
you're the star of the show.
the seed ideas, they are really seed ideas. So it's like, we can approach this area by this type of solution, but then I think that the way you design that solution, so all the details of that solution can really address the person on the emotional level. So it's hard to create a seed idea that is considering all the emotions of people in it, because it is really the way you use data, the way you create the interface, the way you allow people to interact with the solution, how much time you are requiring the people to interact with your solution. This is all part of the emotional experience, right? So of course, some solutions can be more practical and some others can be more, can address the one emotion from the beginning. For instance, vulnerability. And I think these are two different ways of approaching the problem. So you can focus on concrete problems, or you can focus on solving them, or you can focus on how people are feeling and try to come up with design briefs in order to either limit that emotion if it's like fear, or maybe allow people to deal with that emotion better, for instance, vulnerability, or reinforce some emotions like joy. So if people are saying, I feel joyful when I'm in touch with my boyfriend, okay, how can we create maybe more ways or different ways to be in touch with your boyfriend? Because this is one of the causes of joy, right? So these are very different approaches, but I think the emotional side here should be considered in all the solutions we develop, even if, again, at different levels. So you can start from the emotion, and that is your goal, the goal of your solution, or you can develop a solution that solves a specific problem and try to inject the emotional side in it by the way you develop that solution.
It creates this interesting matrix, right, where you have tangible solutions and then the human-centered need. And I think that's always, I don't think it's a challenge. What I think it is I view it as an opportunity to bring people who are more practical in their approach and people who may focus on some of the broader context of the opportunity and come together. Paulo.
Yeah, but isn't that the essence of design at the end? So isn't that what we do? I mean, we have this at Northeastern, the president created this concept of humanics that is like a synthesis of what, I mean, it's basically what design does, and it's a synthesis of the human and the opportunity that comes from technology, and the opportunity that comes from understanding and observing the human components of every interaction we have with the world. So, and also that's why when we launched the Center for Design, I created this human by design. So that's something, I think it speaks pretty much about what design is in essence. So
yeah,
I wouldn't create a brief for that because I assume that it's something that designers are able to take into consideration anyway. So it's not, I don't want to be the one that says to designers, so actually you have to understand what are the emotions and the feelings of users before coming up with something practical and usable. But this should be really part of the way we see the world and the way we approach the design activities. So being able to master the practicalities and the emotional components of every experience. And so, yeah, no, of course, it's fundamental for us, maybe as the other ones that usually deal with people that are more focused on technologies and practical aspects. We have to push a little bit more on emotions and feelings. But yeah, this should be kind of the basis of our process.
Nice.
Yeah, and we allow designers to be very free to explore our data the best way for them. So at some point we were discussing about creating briefs out of it, design briefs, and publishing them. But then we decided not to do that because we wanted to really leave everyone free to explore this and to come up with their own ideas and their own approach to that. But in my view, the design briefs would mix the emotional side to the problem side. So that should be, my idea was to mix these two levels. So for instance, to go back to the idea you cited about being able to book your visit in stores, of course, this should consider the emotions that the people are feeling the most. So anxiety is one of the most recurring negative. So another field, another area we investigated was the negative sensations that people are feeling, that is separate from the emotions in general. And anxiety was one of the first ones. So how can you design a solution like that, but that is able to reduce the anxiety of people instead of adding on top of it, or that is able to help people feel, more hopeful is probably too much, but that they are they are able to manage the time in a proper way. So, a lot of different perspectives that should be really should come together in order to approach this complexity.
Well, thank you. Clark?
To close us out and try to synthesize this conversation is ridiculous because it's not closable. This is really an opening. So I am grateful to both of you for bringing your work to us and the spirit of your work to us. It is, as Jeff mentioned earlier, the inspired by, inspired to equation is in full bloom right now. And as a designer, I couldn't be more inspired by the confluence of research, vision, distance, compassion, and I'm speaking for myself, but I have a feeling that there are 26 other people that are agreeing with me that this is a profound step forward for people with the impulse to help and not a clear path for what to do. We now have a system, and thank you for sharing this.
Oh, this was really the goal. I mean, it feels so good to hear that, because this was exactly the goal, creating a platform for people who want to help in order to allow them to work together. So, I mean, if we reach it even in a small way, but that would be really, really satisfying for us. So it's good. And if you want to help, even in a small way, the initiative, you can help us by taking the survey, because we're still collecting. If you are living in the US or in one of the
Please put the link in the chat, or and I will also share it out to the list. So
yeah,
thank you.
We still need to collect a lot of responses in the US because we have started just a few days ago. So if you can give your contribution, that would be much appreciated. In addition to any design activities you would like to plan, and or anything else, interviews, for instance. If you want to partner, just send us an email, and we'll be more than happy to involve you.
Thank you. Yes, please. If you want to get in touch with Sarah and Paulo, just send me a note, and I will. I'll aggregate the responses to save them the headaches, and then we'll. But please, we look forward to helping you as best we can. So in short, we'll answer your survey and then offer our able hands to grow your platform. So to those of you who have joined us this morning, this was wonderful. Thank you so much. It's truly an honor to host you, and it feels as though the feeling's mutual. So thank you. And Sarah, Paulo,
thank you very much.
We'll be in touch shortly.
See you
Thank you
next
very much,
week.
everyone.
Thank you.
Bye-bye.
Bye. Thank you.
Thank you.
Thank you.